Hey guys, it's Krista. You're here in my office, and today I want to discuss a subject very near and dear to my heart, and that is the subject of birth trauma. Specifically, I want to talk about what it is and what it looks like. A lot of people don't realize that birth trauma even exists, and there's actually a very good but nerdy reason for that. The Diagnostic and Statistics Manual, which is the reference book where all of the mental health categories lie, specifies PTSD with some criteria that I think are kind of difficult to fit around birth trauma. And for that reason, it's been poorly recognized among mental health and medical professionals. But what recent research shows us is that over 30% of women describe their birth as traumatic, and up to 8% of women at any given time have fully diagnosable PTSD as a result of their birth experiences. So while it may be under-recognized, it is not, unfortunately, uncommon. Let's talk a little bit about some of the symptoms and signs of birth trauma, specific to what I notice in my office, to hopefully help you identify it, both in yourself and those around you. The first criteria for trauma is intrusive thoughts. The way that typically looks with birth trauma is sometimes flashbacks about the birth itself. Other times it can be a bodily or somatic experience that is triggered by things that remind them of the birth. That could be smells, sights, or sounds. Why this is important is basically it can look like a variety of things. What I often ask the woman to think about is whether or not it feels compulsive. In other words, once a memory or a felt sense trigger of the birth is activated, does it feel like it's a choice anymore? Or does it feel like their brain is going to stay stuck on that whether they want it to or not? The second criteria is related to mood and belief, which is basically just a very clinical way of saying that this resulting birth trauma has an impact either on your mood or your belief systems. That is to say, either you find yourself feeling perhaps anxious, sometimes guilty, sometimes angry, other times depressed as a result, or that it might perhaps have affected some of your belief systems. Maybe it's uprooted some of the things that you believe in. Maybe it's caused you to feel that there's danger around you. Again, it's a category that's wide-reaching, but those are some of the ways that it's looked in my office. The third criteria is what we call avoidance. And this is the one that I want to caution clinicians to recognize, at least in my clinical experience. Avoidance is variable. In other words, while avoidance might be a part of classic PTSD, what I find with birth trauma is that it doesn't show up all the time, or at least it's not obvious on the surface. Avoidance is exactly what it sounds like. It's an avoidance of things that trigger the traumatic experiences in your body and in your memory. Because sometimes that's related to the baby, women often try to combat that avoidance, try not to give in to it. So while it can sometimes look like avoidance of the infant in extreme cases, and sometimes in moderate cases it can look like avoidance of medical facilities or the doctor who is present, in other cases I don't really see avoidance very obviously on the surface. The fourth and final criteria is the one of high alert, and the reason I really want to bring attention to this one is that I believe in obstetric offices, when well-intentioned physicians are assessing for the possibility of postpartum mood disorders, I think often they are seeing the hypervigilance or high alert of a trauma symptom and misidentifying it or misdiagnosing it as potential anxiety. Why that matters is because the treatment process for anxiety is very different than the treatment process for trauma, and so a correct label or diagnosis is an important part in the first step towards getting the help that you need. And that can look like exactly what it sounds like. An overabundance of worry, an overabundance of caution. Again, it kind of bleeds into that idea of there's danger everywhere. That can sometimes look like an inability to sleep when the baby sleeps, or it can be more generalized where you just feel like there's danger around every corner even if you can't directly trace that sensation back to the birth itself. So by itself that can be a symptom you can tell of anxiety, or it could be hypervigilance from trauma. If you're not sure which it is, I recommend you talk to a licensed mental health professional. They can help you figure out what exactly you're working through and help make good recommendations. If you want more information about how to treat that, I've got some more information on how to treat trauma in general below. I also have another video about things I want you to know if you believe you or a loved one are suffering from birth trauma. That's all for now. As always, like, comment, share, or subscribe. Your support is greatly appreciated. Until then, I'll see you next time. Thanks for spending your time with me.